Good morning, everyone. My name is Carmen, and I'd like to begin by acknowledging that I'm grateful to be presenting from Treaty 1 territory, which is the traditional lands of the Anishinaabe, Innu, Oji-Cree, Dene, and Dakota, and is the birthplace of the Métis Nation in the city of Winnipeg. I'm a registered dietitian, and I'm very interested in international nutrition policy. So I was delighted when I had the opportunity to work with the Pan American Health Organization, or PAHO, which is one of the 6 regional offices of the World Health Organization. And these are all shown in the middle graph on the, or middle graphic, I should say, on the slide. PAHO's work focuses on promoting, improving, and protecting the health of the 35 countries that fall within the region of the Americas. And those are all shown in orange on the middle graphic. I would like to take this time to thank my practicum supervisors at PAHO, Dr. Gomez and Dr. Patino, for providing me with this opportunity and for their trust, patience, and mentorship throughout my practicum. I was fortunate enough to be involved in a number of projects during my practicum, but my main project at PAHO was all about building the capacity of focal points or stakeholders of PAHO member countries to adopt, implement, or strengthen specific regulatory nutrition policies in order to improve the diets and health of people living within the region of the Americas. And over the next few slides, I will go into more detail about this work. In the past few decades, there has been an increase in non-communicable diseases, or NCDs, and NCD-related mortality rates within the Americas region, as shown on this slide. Therefore, to address important aspects of this issue, the 35 member states of PAHO unanimously approved a plan of action in 2014 to halt a further increase in these NCDs in the Americas by focusing on the implementation of specific regulatory nutrition policies, which is what the guidance documents on this slide are all related to. Although there have been successes achieved over the years in a number of these countries, there still is a lot of work to do to help all country focal points within the region implement the recommended regulatory nutrition policies to help improve the food environment and halt the increase of these diet-related NCDs within the region. And that is where this current capacity building project comes in. For this project, our capacity building efforts were specifically targeted at the focal points of ministries of health, policymakers, civil society organizations, public health professionals, and PAHO country and sub-regional officers within each country across the region of the Americas. And we were working to support these stakeholders to develop a regional capacity building strategy to advance the adoption or implementation of regulatory nutrition policies. Now, when it comes to capacity building itself, it is a broad term that can be defined in a number of ways, but I use the capacity building definition by the World Health Organization to help guide this work, which is the development of knowledge, skills, commitments, structures, systems, and leadership to enable effective action. And I would add sustainable action to this. As you can see from this definition, it is an all-encompassing term, which means that capacity building work can take many different forms. And the specific regulatory measures that we were supporting the focal points of countries to implement included the regulation of food labeling, fiscal policies such as sugar-sweetened beverage taxes, the regulation of the school food environment and other settings such as universities and workplaces, and the restriction of food marketing. Now, these 4 regulatory measures all aim to reduce the demand for and offer of sugar-sweetened beverages and other ultra-processed products that are high in fats, sugar, and salts, and were selected as the main strategy to halt the increase of NCDs because they are a cost-effective strategy that can be sustained over time. Additionally, a crucial component to ensuring the success of these 4 regulatory nutrition policies is the focus on preventing and managing conflicts of interest, which was another key piece of this work. In order to ensure we were supporting the country focal points to develop a capacity building strategy that would be as relevant and effective as possible for the focal points of the countries within the region to implement the recommended regulatory nutrition policies, we organized a multi-day workshop and invited the country focal points to participate. Beyond helping to organize this workshop, I also conducted a literature review and wrote a background technical paper that was sent to the country focal points to provide them with an overview of the current situation within the region of the Americas in relation to the high prevalence of NCDs, which is shown on the slide, to provide an update on the number of countries that have implemented each of the regulatory nutrition policies, which are also shown on this slide, and to communicate the importance for these regulatory measures to be implemented in order to halt the increase of NCDs within the region of the Americas. One of the capacity building tools identified for us to create was a virtual learning course with modules on each of the regulatory nutrition policies. And I was involved in helping to develop these modules along with my practicum supervisors and Dr. Hill and Dr. Collin, who are experts in conflicts of interest. The course is still under development, but once it is complete, it will end up on PAHO's virtual learning campus, which is accessible to all of the country focal points mentioned previously, in addition to being accessible to the public. I do think it is important to mention that because capacity building is so all-encompassing, PAHO's work to support the stakeholders to implement these regulatory nutrition policies will not stop after this virtual learning course is complete. It really is just one of the many ways PAHO is working to try and fill the gaps that country focal points are experiencing when trying to implement the regulatory policies that work to improve the food environment within each of the countries in the region of the Americas. A few key takeaways for me from this capacity building project are, number one, the importance of engaging with a variety of focal points from each country in order to identify regional capacity building needs, especially considering countries' political, legal, economic, cultural, and ethical contexts are different across the region of the Americas. Number two, given the strong industry influence that is present in many countries, advocacy efforts are essential to the success of quality policy development, implementation, and enforcement, and for the sustainability of policies. Number three, when working to halt the increase of diet-related NCDs within the region, implementing complementary nutrition policies is key, as opposed to only implementing one policy within a country, because this more comprehensive approach has been found to increase the strength and overall impact that a country can have on reducing diet-related NCDs. Lastly, a key takeaway for me was the importance of highlighting the success of countries so that other countries within the region can learn from one another and can potentially see the implementation of these regulatory nutrition policies as a realistic and achievable approach to tackling NCDs. Before I begin answering questions, I would like to take a moment to thank our practicum instructor, Dr. Jeff Mazuda, our practicum coordinator, Heather Ulmer, my second reviewer, Dr. Namey, and all of the other faculty members for your support throughout this degree. It was greatly appreciated. Thank you all for listening. And does anyone have any questions?